All right, for this I'm going to use a furniture slider. If you're on carpet, a slider or paper plate works really well. If you're on a smooth floor, towel also does the trick. This is going to allow me to move my hip into multiple ranges of motion so I can pull at things with a little different angle with each one. I'm always trying to stay short of any pain, so if you have one of these spots that is painful, you either avoid that or you shorten how far you go, right? So I'll be standing at a counter or a table, and I put my foot on this slider. Now, the leg that's on the slider is going to stay pretty straight. The leg that's not on the slider is going to bend a little, but I will tell you that most of my patients, when they do this, if you look at my leg that's not on the slider, right, just so you can see from here, as they slide, a lot of people tend to let this knee go too far forward, right? So to avoid that, I'm going to try and stick my butt out so I'm sitting more onto my heel as this leg slides. So starting off here, I get my weight a little bit back on my heels, and as this leg slides out to the side, I let my body follow that foot. So I kind of let my hands stay wide, and this knee is just slightly bent. And as I pull back in, I think about engaging my stomach as I pull that foot back in. Okay? So if we're looking at a clock, this is 12 and that's 6, that would be maybe 9 o'clock, right? And I'm going to come back on an angle, and that would be 8 o'clock. Same thing as far as comfortable, engage my stomach, and then I'm going to change the angle and head towards 7 o'clock. And then I head straight back towards 6. Now you'll notice, like I said, that my upper body follows that foot. And I like having something that I can brace myself on. So as I go to pull, if I don't have anything I'm holding on to, there's a tendency from here to do this. I want to make sure that doesn't happen. So it's nice if I have either a post or this table or counter so I can engage my stomach before I pull that foot back up. All right? So just so you can see what it looks like from the front, I'd be holding something, right? So without me holding something, it's a little bit more difficult. But I really want to make sure that this knee is not bent a lot. And like I said, if I have any pain in any of these ranges, I would avoid it. But I let my body follow that foot. And you'll notice this knee doesn't bend a lot, and especially since my foot is going this way, I'm not letting it cave in. So I'm keeping my knee somewhat out to the side as I use this heel to pull me back up.